Can you hear me okay? Okay. My name is Dr. Ria Chaco. I'm a cardiologist at Crouse Hospital. And just a little bit about myself. We were saying I'm not originally from Syracuse. I'm originally from the Texas area and moved here 5 years ago, but I've been in the Northeast for about 20 years or so. Today we'll be talking about stress in the heart. And again, I wanted to thank you guys for coming out in the bad weather. So I first wanted to start off with a quote, and it doesn't matter what your religion is, but let not your hearts be troubled, neither let them be afraid. John chapter 14, verse 27. So no matter what religion you are, I think all cultures kind of value a sense of inner peace and a form of stress modification, if you will. And I always laugh because why am I giving this talk? Why am I giving this talk? And I think it's because I'm the perfect person. I work long hours, 11 to 12 hours a day. I work on nights. I work on weekends. I help people deal with very stressful events. They're having major heart attacks. They're having cardiac arrests. They're going to have major heart surgeries. Some of them die. And I have 2 young kids, ages 4 and 2, and my husband's a physician and takes calls. So I think I know a little bit about stress. So for today's talk, I want to talk about why it's important. And I find that I learn from other people. And I found a pattern where successful people know how to manage their stress. Then we'll talk about how does stress actually affect your body and what's the link between heart disease and stress, and then what can you do about it. So successful people know how to meditate. I'm sure you know many. And I think it's become a thing recently where people are coming out and kind of acknowledging that they do stress modification. So Michael Jordan, Gisele Bündchen, Deepak Chopra, Oprah Winfrey, Romani Ayre, CEO of the Hartford Group, Tom Brady, no matter what you voted for in the Super Bowl. But if you watch the Super Bowl, you know that it's not just a physical, but it's really a mental game. Madonna, Jerry Seinfeld is a big proponent of meditation. Bill Ford, the CEO of Ford Motor Company, to name a few. Buddha once was asked, "What have you gained from meditation?" And he said, "I've gained nothing. But let me tell you what I lost. Anger, anxiety, depression, insecurity, fear of old age, and death." Now, Ray Dalio is a billionaire, multi-billionaire, and a founder of Bridgewater Associates, which is the world's largest hedge fund. So you could kind of say he's a little successful. And he once was quoted as saying, "Meditation, more than anything in my life, was the biggest ingredient of whatever success I've had." It's so important that some companies value that they know that their employees are more successful and better at what they do if they can manage their stress. And it's called mindfulness, mindful meditation. Google, AOL, Apple, Aetna, they all kind of sponsor classes where you help modify your stress. But how does stress actually affect your body? I see it all the time. I think this is very interesting. What's the definition of stress? Stress is psychological arousal. And it can either be acute, you had a life stressor, an acute event, or it can be chronic. It's just day to day, it adds up and it wears you down. Coping is how do you contend with stress? And it usually requires a lot of energy on your part to deal with stress. Studies have found, if you've ever noticed white coat hypertension, that just entering a hospital, people have elevated epinephrine, norepinephrine, cortisol, growth hormone levels, all your stress hormones. They found that students, when they have exam time, they studied they have elevated blood sugars despite what they're eating. Their blood pressure goes up. Their white cell goes down. They get more illnesses. They can't find illness as well around exam time. And around this time, tax accountants, this independent of their diet, their cholesterol goes up. Nothing changes in terms of what they eat, and they have prolonged clotting times. I found also this is very powerful, that arousal is high among those who have little control over life events and those who have high performance standards. And if you think about yourself, doesn't that kind of describe what things that stress you out? Acute arousal causes sympathetic stimulation and an increase in cardiac output. Public speaking, here we are, is a form of stress for people. And this was an example. They had medical residents give a talk. And so in the beginning of the talk, our epinephrine goes up, and then eventually it'll go down. This poor man stayed elevated because his PowerPoint stopped working, so he had to do everything on the top of his head. So what do we know about meditation and your heart? Isoproterenol is a drug that increases your heart rate. So the control got isoproterenol, and their heart rate went up as expected. But those who were meditating got isoproterenol, and their heart rate started to come down. So we have data that proves that meditation works. We know that stress can affect your cholesterol because it increases the stress hormones that increase serum cholesterol production. They found in rabbits, if you expose them to a lot of stress, they have increased atheromas or cholesterol plaques in their arteries. We also know that stress can cause your blood pressure to go up. I see it a lot when people are happy to see me. It's nothing personal, but coming to see a doctor can be very stressful. It's called white coat hypertension. So stress can cause high blood pressure because it can repeat your blood pressure elevation. It increases vasoconstrictor hormones that cause your blood pressure to go up. And it's interesting, some people say, well, yeah, I had a lot of stress, but why is my blood pressure still elevated? And it can remain even when your stress is removed. Stress can increase the risk of diabetes by activating glucagon and other stress hormones that suppress insulin secretion and mobilize glucose and fat. So they go into your bloodstream, and as a result, you get hyperglycemia, hyperinsulinemia, and hyperlipidemia. But what about stress in your heart and cardiovascular disease? And this has been studied. I see it a lot. I would say 7 out of 10 patients that come to see me have palpitations, chest pain, high blood pressure. And unfortunately, and it's always worth our time to talk about what's going on in your life. Is there stress that could be contributing to your symptoms? And the answer is often yes. And we studied this. We know that stressful events cause increased events in cardiovascular death, and we studied specifically in earthquakes. The Northridge earthquake in 1994 happened on January 17th, and there was a huge jump in cardiovascular death. So they said, well, what happened that day compared to the years preceding? Nothing. Nothing was different except for the fact that the earthquake was very stressful. We found that people who have known coronary disease actually have a drop in their heart function or regional wall motion abnormalities where one part of their heart doesn't work just by having them do mental math. The Inter-Heart study found that in 25,000 people, if you have chronic daily stress, you will double your risk of having a heart attack. If you ever take care of a sick person in your family, whether it's your mom or dad or a child, they found that the caregiver health effects study, there is a 63% increase in mortality among those who were caregivers than non-caregivers. World Cup soccer matches, they found that you have a 2.7-fold increase in acute coronary syndrome. And in a German study, they found because these people actually had an increase in pro-inflammatory markers. This makes me laugh because, ironically, we also know that it's really bad for you to be angry. Anger outbursts in a meta-analysis, so they looked at 9 studies on acute coronary syndrome, stroke, ventricular arrhythmias. You had the highest risk of cardiovascular disease in the first 2 hours after having an anger outburst. And you know that to be true, right? When you get angry, you feel your blood pressure go up, you feel your heart rate go up. Now, we know there's something called a stress cardiomyopathy. I see this not infrequently in the hospital. It's usually in older women who have a stressful event. My favorite was a woman who was mad at her cardiologist because he took too long to see her, and she had a heart attack in the waiting area. So you have chest pain, EKG changes, your heart enzymes are abnormal, but you don't have blockages in your heart. And actually, you have takotsubo. So your heart balloons out just from stress alone. And the prognosis is very good. But stress-induced cardiomyopathy, it's real. Can you die of a broken heart? You can. Now, what about stress modification? Is there actually science to support that relieving your stress is helpful? And they found in a 2012 study that those assigned to meditation actually had a nearly 50% risk reduction in all-cause death, heart attack, or stroke, and a 25 or approximately 25% risk reduction in revascularization, stenting, hospitalization, mortality, blood pressure. So the answer is yes, and that was just meditation. The Yoga My Heart study studied atrial fibrillation, which is an irregular heart rhythm. And they followed people for 3 months, and they didn't do anything. And then they had them do yoga twice a week for 60-minute sessions over the next 3 months. And they found that there was a significant change. In those who had symptomatic and asymptomatic atrial fibrillation, there were statistical differences in a drop just with yoga. Why would that be? Because with yoga, you increase your parasympathetic tone, and you're kind of training your heart rate to go down and and helping your breathing. The PIMI study was a psychophysiologic investigators of myocardial ischemia study by the National Heart, Lung, and Blood Institute. So sometimes I think in cardiology we're very based on fact, and when you talk about stress modification you think, well, this is just kind of fluff medicine, it's not real. But these are things that are actually supported by the NIH. So they studied 196 patients, and they did mental stress testing, exercise treadmill testing, and Holter monitoring or ECG monitoring. And all of these patients had established heart disease, a positive stress test, and were off their medications for 48 hours. They had to give a speech voicing a complaint to make them feel uncomfortable, and then they were told they were going to be judged for their speech. And then they did a Stroop test where they flashed something in a timed fashion and made them confused and it stressed them out. And then they did a nuclear stress test. 58% developed either ischemic EKG changes or abnormal stress tests just by doing mental math or giving a speech or flustering them. And those with daily life ischemia, so they wore the Holter monitors and they found that they were having positive EKG changes, had higher resting hemodynamics, and their response to stress was much more exaggerated than if they did not have daily life ischemia. And if you had chronic daily life ischemia, you were more likely to have mental stress ischemia. So mental stress ischemia, unlike exercise, is associated with increased vascular resistance or vasoconstriction. So look at the controls. With exercise, this person who has known blockages in their heart will have perfusion defects. If it's completely black, that's normal blood flow. And these places where you don't see it is abnormal blood flow. So that's expected, right? But look what would happen if you just had them do mental math. They would have similar perfusion defects. So again, a quantitative kind of way to prove that this is real. They found in people that were healthy with a mean age of about 62, if they had a heightened cortisol response to mental stress, they actually had detectable levels of troponin, which is an abnormal heart enzyme that's leaked. The Duke University did the ENHANCE trial, and they studied cardiac rehab. So if any of you are familiar, if you have a heart condition, you're referred to cardiac rehab, which is just like, monitored training in a gym. So they assigned patients to cardiac rehab and followed them for 3 years. Over 12 weeks, some were given rehab with stress management, and others were just given plain rehab. And they found there was a significant reduction in clinical events in the ENHANCE trial in patients who had stress modification along with the rehab than the cardiac patients that were just given cardiac rehab. Depression is an important factor also in cardiovascular disease, and it's something that we don't do a very good job at talking about with our patients, and I try to be sensitive to it. That after a heart attack, people have post-traumatic stress disorder. It's a very stressful thing. If you have depression, you will increase your risk of death over the next year and a half. And actually, it occurs in 1 in 5. And again, if we're not getting counseling about how do you feel after your heart attack, do you feel depressed, we could do better. Now, why is it that people are more likely to die if they have depression? And the reason is because they're probably less likely to follow your recommendations. They don't eat well, they don't take their medications, they think, well, what's the point? So now we've talked about how bad stress is, but I guess you didn't need a talk to tell you that. You didn't need a cardiologist to tell you that. But what I can tell you is that it's real, and I see it at least every 7 to 10 patients, out of 10, every 7 patients will have some form of stress that's contributing to their symptoms. But what can you do about it? So I'm going to go over just a few things. It's not a comprehensive list, but this is really taken from the American College of Cardiology. So as a cardiologist, what can we officially recommend? So or what can we officially comment on? Acupuncture goes back to 206 BC, and they've actually found that in acupuncture, sometimes you can improve blood flow to your heart by decreasing sympathetic flow. And how is it? It releases natural endorphins, kind of like exercise would. And in small trials, they've actually found that people who do get acupuncture actually do drop their blood pressure. There's also the science of bioenergetics. Many cultures believe that people have a vital life energy. If you're Hindu, you call it prana. If you're Chinese, you call it chi. If you're Japanese, you call it ki. And there's actually some science to bioenergetics that we think that it's possibly mediated by the same thing, TNF-alpha, that's linked to the reward response system. We know the placebo effect is real. Why do people get better if you give them a sugar pill, right? So there must be a reason. It's not just in their head. And that's one of the reasons, that we think, TNF-alpha. So technically, there's no science to support the use of bioenergetics, but that doesn't mean that it doesn't help. What are different forms of bioenergetic therapy? Relaxation therapy. So in a study of 192 men with 2 or more risk factors, they actually had better outcomes in a control group when they were given relaxation techniques. And we know that type A personalities that have higher blood pressures, and they have a higher incidence of death from cardiovascular disease. We also know that yoga lowers your blood pressure, and it alters your breathing pattern, and it increases your oxygen uptake, and it decreases your heart rate variability. It decreases your sympathetic response, and it can alter your cholesterol profile. But according to the American College of Cardiology, the data on yoga is too preliminary. So I found this interesting because I really didn't appreciate the science of meditation and relaxation until I met Deepak Chopra's brother in Boston. He's a professor of medicine at Harvard, and he actually does a lot of the continuing medical education. He's the director. And a lot of their family actually does yoga, and his nephew is a pulmonologist and helps his patients learn breathing techniques to help them with COPD, lung cancer, by doing yoga. And that kind of pissed me off that, well, maybe there's something to Qigong. Qi is a life force energy, and Gong is a practice of skill, the translation. And it integrates posture, breathing techniques, and mental focus. And there's an internal form, Tai Chi, and it's shown to improve your heart rate and respiratory rate, and after you have a heart attack, the rates of hospitalization. And there's an external form that's performed by masters, and that's Kung Fu. Now, we don't know the benefits of Tai Chi on your heart. Does it hurt? Absolutely not. And it can help? Absolutely. Are there major studies showing Tai Chi can affect your heart? No, and I don't know if there ever will be, because the interest is variable, but definitely we know that it helps. Reiki is a deep relaxation technique that uses healing energy, where masters place their hands over certain chakras over points of your body. We don't have evidence that there is a scientific benefit to it. Does it mean if you practice Reiki that that's bad for your heart? No. Meditation is not uniformly accepted as a form of bioenergy, but we do have studies, and I think it was recently in the news again, how they've done plenty of studies at Harvard and other places where we know that we can change the brain flow, blood flow, by MRI when people meditate. And in people who meditate, they actually have a change in their brainwave energy that's detected by EEG that's almost as if they're sleeping in a deep sleep. We know that meditation alone will decrease your blood pressure, reduce your heart rate variability, lower your respiratory rate. But officially, I can't recommend it as a cardiologist by the ACC guidelines. Do I think it helps? Absolutely. And I tell a lot of my patients that if it's not meditation, and I'll go through there are other ways, such as prayer, but stress relief is important. So in terms of prayer, there were 4 randomized studies in the field of cardiology that looked at prayer, and actually most of them did find that if you prayed for a person, they clinically did better. They just couldn't reach clinical significance. So can I say that prayer, I think, is a form of meditation? So whatever your religion, if you take time to pray, could it help your heart? I'm sure it could. Can I prove it? I can't yet. So again, the official statement from the American College of Cardiology is that all of these serve an adjunct to standard medical therapy, but in no way are they a substitution, and that's also important. So in conclusion, when you think about stress, how it affects your heart, remember successful people. And like I said, I like to learn from people who are better than myself. Successful people know how to manage stress, whether you're an athlete, a top model, a businessman, Tom Brady, Oprah Winfrey, Jerry Seinfeld. But there's a pattern. And I think if people who are highly successful, who have more stress than you or I, know how to manage their stress, they must be doing something right. We talked about today that there are many ways that stress can affect your body. It can increase your risk of heart attack. It can cause mental ischemia, and we know that that's a real thing. We know that it can cause your blood pressure to go up, your cholesterol to go up. It can increase your risk of diabetes. And like I said, there is such a thing as daily life ischemia, and it's the chronic daily stress that wears you down. There are things that you can do, whether it's Qigong, yoga, acupuncture, prayer, Reiki, meditation, and the list goes on. These are just a few. But there are things that you can do to help with stress in your life and ultimately your heart. And I'll end with a quote from Buddha: peace comes from within, so do not seek it without. As a mother of 2 toddlers, going back to why am I giving this talk, I know this to be true, that anything is possible when you have inner peace. That's it. Are there any questions? Yeah. In terms of stress modification? Definitely it's a form of stress modification, but I always tell my patients sometimes it's easier to exercise than to sit still. So we know that exercise improves your cardiac function, and obviously it helps your cholesterol, it helps your body weight index, and exercise releases endorphins, which is good for stress modification. So it's a healthy way, but in people who exercise a lot, who still have stress, and they ask, well, what else can I do? It's actually harder, I think, to practice being still and not do anything. So it's a good thing, and it's a form of stress modification, but it's not considered a stress modification technique or a form of mindfulness for that reason. Does that make sense? Well, it's interesting you should say that. So living in Boston for 10 years, the Boston Marathon, we commonly in the emergency room have a lot of people who are actually extremely healthy. They're marathon runners. So there might be, I can't quote a study off the top of my head to kind of confirm, but we do know that people do have positive troponins after they do big marathons. A lot of people pass out when you push yourself to a certain degree. I see when I do stress testing, when people who think they're very athletic and they say, I can keep going, I know based on your heart rate, there's a limit to what your heart rate can do. But I do know that people who are generally healthy have positive troponins when they come into the ER. So is there some stress to their heart? Is there such a thing as overexertion? There possibly is. Do we say that officially? No. I always say listen to your body, and also age dependent. There are some 90-year-olds that are in better shape than some 30-year-olds. But you have to know what you can't do at 90, which is what you could do at 30. Yeah. Yeah. Right. Yeah. 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 I'm sure. Versus a city. Yeah. Yeah, I'm sure. I'm sure that's true. Why is it that we don't study this very well in cardiology? And I'll be honest, it's not a drug that I can give you. There's not a drug company that's going to sponsor it. So there is probably less interest to study these things. But fortunately, because there's interest in our culture and the general population, and people who are highly successful physicians and business people are coming out and saying, you know what, a little known secret, but this is what I do to manage, and it actually has helped me. So now there is more interest, and now there are places like Duke University and Harvard and the National Institute, of Health that's coming out with studies. So I think that's, personally, I prefer studies coming out from that area than from sponsored drug companies. But it obviously will have a different level of attraction. Yeah. One versus better than the other? No ranking. Yeah. Yeah. How do you do it? Well, I'm no expert. I'm just a doctor. But there are different, there are people that teach meditation. And so if you're interested in learning how, you can learn online. You can get a video. You can get a CD. I first found out about it, naturally because I bumped into Dr. Chopra, who taught me, he's a hepatologist, and he made liver disease sound wonderful. Just by the way he talked, you can feel your pulse and your blood pressure just drop. But you either learn from someone in person or online, and then you practice it. So for me, Deepak Chopra actually has, and I'm not endorsing it, but I'm just telling you what I do personally, has a website that teaches mindful meditation, and there are some free things that you can listen to. But each person is different in terms of what you think you can do. I would think the best way to practice it is in a formal setting so you learn the technique. And then ultimately I think everyone practices it at home. And it's one of those things you do. If you get up, if you go to work at 7, do it at 6 a.m. You do it for 15 to 20 minutes. And I tell you, as a mom of 2 little children, it's the hardest thing I can do is to not do anything and sit still. But it helps, and it helps find my. It really is hard. It's harder for women, I think. And I know it's a mom thing. It's a mom thing. I got to do. And the kids are usually, I'm hungry. I need my milk. And you got to think about what you're going to make for dinner and who's going to do that. So it's actually really hard. I think it's much easier to go to the gym. It's very easy to exercise. It's harder to not do anything and just release your mind of all the distractions. But does it help? Absolutely. Does that help? Yeah. Mhm. And if you feel like you're failing because you're distracted, so you're trying to do the deep breathing, but then you're thinking of dinner or the baseball game or what have you, it's okay. And so one of the things I learned in meditation is it's okay to be distracted because it's actually perfectly normal. But once you get better at it, you lose the distractions. One thing I think is interesting is if you look at the origins of yoga, yogis from India could lower their heart rate and their blood pressure so much when they were out in the forest that they almost appeared dead to animals. And that's impressive that you can, and that's actually a really extreme form of yoga where you can do that and you can lower your vitals so much that you would be clinically, it would look like you were almost not alive. So we know that it works. And you know the opposite of yoga. You know when you get mad or when you get upset, your heart rate goes up and your blood pressure goes up. So if the opposite is true, right? Yeah. 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 Right. I think there are a lot of resources, and if you Google them, either you find them online, or find, if you need an environment where you need to kind of be with other people to kind of see what this is about. But I think it's a secret. It's not something that Western culture is used to doing. I certainly wasn't used to doing it. And cardiology is very fast-paced, and like I said, we live on stress. Like that is our job, and we help deal with it. But I find that I spend a lot of time actually helping people deal with what's actually causing their chest pain sometimes, what's actually causing your palpitations. I never tell people you are stressed. They always tell me at the end of the conversation, you know what, I think this is stress. And sometimes that's the first step, and that's okay. I can never guarantee you that you won't have stress because we all do, whether it's a winter storm or you get a phone call that someone you know passed away or your mom's sick or you lost your job or you have a health scare. It will happen. We're all human. But how you react to it and how you have trained your body to react to it. And remember, people who have daily life ischemia, they have higher heart rate variabilities, and their response to stress is exaggerated. So if you're beaten down every day, one more hit, and it's harder and harder for your body to cope. So it's not that people who meditate are perfect and they have no problems. Oh, they have problems. They just learned how to control their body's response to it. And I think if there's any secret, and if you're the richest hedge fund billionaire in the world, and that's your secret to success, I think that's something to be said. Well, it's funny. I don't know that it's uniform. I don't know that it's standard. But when I was in medical school, I went to Jefferson in Philadelphia, and I worked with a neuropsychologist. And he was actually asked many times to hypnotize patients undergoing brain surgery, because the neurosurgeons would find that those who were hypnotized bled less in their brain. And so he, as a neuropsychologist, he worked on the neurosurgery service, helping people kind of focus. And so could we use it more? I'm sure we could. And actually at Crouse Hospital, when I had given this talk before, I didn't even know we have resources for patients already. On the maternity floor, we offer stress modification, free mods, food. And so there are resources available, and it's just we have to know that it's an issue and then actually know that, where to seek them. Any other comments or questions? Oh, sure, yeah, no worries. Yes. Yeah. 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 Oh yeah, definitely. And you're absolutely right. So some people don't want to be in a hospital, and some people when they enter a hospital, their cortisol and their stress levels go up. Other people have no problem working in a hospital. Some people don't like being in a board meeting. Other people thrive on that kind of environment. So yes, so the stress can be perceived differently for each individual. That's fine if you enjoy your work, and that's I think when you know you're in the right field, right? And sometimes it's okay if your job is stressful. It doesn't mean you have to quit it. You just have to think, well, how can I modify this so it doesn't wear me down and increase my risk of a heart attack and diabetes and give me high blood pressure? And I've seen that also, where people are in rough shape, and then the next time I see them, their vitals are a lot better, and they've lost weight and their blood sugar is better. And they say, well, what did you do? And they say, well, I changed my job. So if it's something that's causing so much negativity on you, then you have to think, well, how can I modify it? How can I modify my reaction, or am I just in the wrong place at the wrong time? Yeah. 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 Oh, well, it's funny you should say that because I have read studies before where good stress is still stress. Getting married is a good thing. It causes a lot of stress. Buying a new home, moving to a new location, getting a new job, it's a great thing. It causes a lot of stress. So it's funny because some people say, well, I don't know why I feel this way. I mean, I just got a new home. I just had a new baby. Having a new baby is very stressful. So actually, good stress can have an equal an effect on your body. You just have to recognize that, right? That's a valid point. Right, right. Well, it's too much of a good thing. Well, too much of a good thing. And I think one thing I learned from that when I read about it was they had quantified stress levels, and you would think those things were good. They should be lower on the stress scale. They weren't. They were actually pretty high, and that kind of made me laugh. And I guess one thing at a time. Oh no, I take patients. Yeah. So I see patients, every day. I'm in the office, and I see patients in the hospital. So it's a nice continuity. I've seen people who are having heart attacks, and then they have the stress and the depression about it. And you want to get in and out of the hospital when you're having your heart attack, but I love talking to them about it when we're in the office. And it's sometimes harder for men to talk about. But I think everyone appreciates talking about it because it's like, oh, what a relief. I can actually tell you. Some people who have chest pain right after their bypass surgery, it's like, well, what is really bothering you? And I was scared to death that I almost died. And suddenly their chest pain will get better, So it's real, and it's not in your head. And if you ever think and you can't tell if you're having stress, panic attacks can simulate a heart attack. And if you can't tell, I always tell people, go to the ER. That's our job. And then if we can say that it's not your heart, then let us help you deal with it. And like I said, stress-induced cardiomyopathy, I see it every few weeks in the hospital. It's real. I just saw an echocardiogram the other day that looked like that angiogram, the ventriculogram I showed you, and her heart function's terrible. The good news is it will get better. Yeah, what is it? Yeah, it's filling your heart, so your heart should be like this. And it's called takotsubo because in Japan, that's the vessel that they capture an octopus. It's called the takotsubo. So if you go back, it's shaped like an octopus, and it's very interesting. That I don't know why. I don't think, but yeah, but your heart will be shaped like that. And here it is, and it's a known thing. Now, if you have this, and if I see you in the emergency room and you're like, I had a woman who went to go visit her husband's grave and had severe chest pain and ended up coming in and it was takotsubo. So by your history, I can't tell for sure, so we do have to cath you and make sure that it's not a heart attack from a blocked vessel, but sometimes we don't find the blocked vessel and then it's, we know by your history there was a stressful event. You'll still be very sick. People will still be in the ICU sometimes or have a legitimate heart attack, but the good news is the prognosis is very good. By 3 to 6 months, their heart functions back to normal. But, I mean, we know that this is real. We didn't know this 20 years ago. So when you hear, oh, so-and-so died of a broken heart, well, I guess it kind of is true. It's not a blockage. So normally a blockage would cause your heart to be dysfunctional. So, and here, if this is normal and this is abnormal, the heart just balloons out. There's not a blockage. It's just stress-induced. For blood pressure? Yeah, sure, yeah. Yeah. Usually the systolic is what we're aiming for. Yeah. Yeah. They're both important, and they both tell you something, but usually it's the systolic that we pay attention to and treat. And ironically, you can stress out about your blood pressure. So I had patients who, you're nervous to see your new doctor, your blood pressure is 150 over 90. Usually I try not to overreact, so I say go home and check your blood pressure, get a blood pressure cuff. I actually do find that your readings at home, as long as your cuff is accurate, is more accurate than our readings, even though we know what we're doing, because you're stressed out to come and see us. And we can over-medicate you, and that's not a good thing either. But then you go home and you're stressed out because you have high blood pressure now, and now you're afraid you have to take medications. And if you check your blood pressure multiple times a day, I find that your blood pressure will be fine, and then it'll go up, and then it'll go up again. Or if it's high, it'll go up the next time. So I always tell people, you can stress out about your blood pressure and cause your blood pressure to go up. So we talked about, that's okay, but you don't cause arrhythmias. So when people come in with AFib, they always ask me, what did I do to get this? You didn't cause your AFib. Your heart was prone to develop it. But we do know that there are some studies that have shown, for example, the Yoga My Heart study, where you can teach your body. They had people do yoga, do nothing, and then do yoga, and they found that during those times with EKG monitoring, they actually had less AFib, whether they knew they had AFib or not. So there may be, and I can't say that we recommend that. I can't say you can control your AFib just with yoga, because you do have to take your medications. But will it help? Sure. We do know that arrhythmias can be triggered by kind of catecholamines, definitely. Exercise can induce it in some people. Excessive alcohol can induce it in some people. So the opposite must be true. But at the same time, you don't cause your arrhythmia. And some people say, well, I was under a lot of stress. Is that why I got my AFib? I'm sure it didn't help. But is it a cause? No, because you and I could have the same amount of stress, and one of us could develop an arrhythmia and not the other. So there's a reason why, right? Yeah. Dehydration can increase your risk of palpitations. I always tell people, treat your body well, and it'll treat you well back as best as it can. If you abuse your body, you don't eat well, you smoke, you don't exercise, you don't go to see a doctor on a regular basis, it will catch up to you. And I'm just saying that from personal experience, just seeing it on a daily basis. My biggest fear is when I see the person in the ER with chest pain that says, I'm perfectly healthy, I haven't seen a doctor in 20 years. Then I know that we're going to find something bad. So treat your heart well, and it'll do its best. I can't say you're not going to get cancer. I can't say that you're not going to have issues, but it's the best that you can do. Well, that's true. So it interfers for men and women, but a glass of wine, a serving of alcohol a day, it doesn't mean that you have to drink, but a glass for a woman each day is kind of the upper limit. 2, believe it or not, starts to hurt you. So for men, 2 is the upper limit. So I have some gentlemen that say, well, I don't drink too much. I just have like 3 beers a night. That might be a little too much because it adds up over a course of a week. And definitely the binge drinking. We know for a fact it affects your heart. It can cause a cardiomyopathy. It can cause atrial fibrillation. It's called holiday heart, where someone goes out, they party too much, and then they go into rapid AFib. So we know that that's a fact. So like everything in life, everything in moderation. But you don't have to drink. But if you do, it's okay. It's just the quantity is important and the frequency. No, it's not for sure, but you want to kind of find out how old were they, what were their risk factors, did they smoke, and then mention it to your doctor. And then they go through your symptoms. Do you have chest pressure? Do you have pain in your jaw, your arm, your back? They look at your EKG. Do you have diabetes? Do you have high blood pressure, high cholesterol? And then based on those things, they decide if you're appropriate to have further attention, to see a cardiologist. But it's always good to know your family history, actually. I know a lot of people we don't talk about it, right? I didn't ask my brother. I think he has heart disease, but we don't talk about it at Thanksgiving or Christmas or whatever. But sometimes it's good to know those things, because if your brother had a heart attack at 35, there's a genetic predisposition in your family. Anything else? I don't know. Oh, really? Oh. Presentations will be available. Actually, I don't know. Oh, okay. Oh, fabulous. So I guess the answer is yes. Do you have any questions? Well, you just want to, first, you never want to assume that it's stress. My job is to prove that you're not going to die from whatever you're complaining about. So I always tell patients I work backwards, and I say, what can kill you? And I prove to myself it's not this, it's not that, it's not that. And then, like I was saying earlier, I don't tell people that they are stressed, because that's not for me to tell you. But everyone will tell me. You know what? And it doesn't always come out in the first few minutes or the half of the conversation, and it might be towards the end when we're wrapping things up. But everyone has insight, and I think everyone knows. So once we rule out that it's not your heart, and we do testing that's appropriate, or if you have palpitations, we know it's not AFib, we know it's not an arrhythmia, then we talk about stress, what's causing it, and then what you can do about it. And that's when I talk about stress modification with my patients. And I don't know that all cardiologists do it. I don't know that all physicians do it. But I do know, like I said, that I know plenty of physicians themselves who practice mindfulness. And it could be anything. Like I said, it could be prayer. It could be whatever, meditation. It could be yoga. But it works. And I find that taking the time to talk to people about what they feel comfortable doing to modify their stress is very helpful. I had a patient the other day who lost a lot of weight and had issues with his weight. He used to weigh over 500 pounds, he told me, and now weighs in the 200s, which is a significant amount of weight loss. And I said, well, how did you lose the weight? And he said, I first tried to understand the stress of why I was eating. And I went to a therapist and talked it out, and I found out what it was. And I find that very true. And I know, actually, when people tell me they're stressed, the next question is, what are you doing to compensate for your stress? You're either eating more, drinking more, or smoking more, or using drugs. I rarely have the patient that says, I'm so stressed I needed to go exercise. I'm so stressed I needed to eat more vegetables. Right? So I know that if you're stressed out, there's something that you're doing that has a negative effect. And so learning that the negative effect, you see the side effect, you see the obesity, you see the diabetes. Learning why you eat, what's causing what's the reason behind it, is actually, I think, the first step to stopping that pattern. And for him, he lost a lot of weight by realizing the emotion behind why he was eating. I know that for myself. When I'm tired, I eat more. It keeps me awake. I'm not saying it's a good thing, but when you recognize what you're doing, it's the first step to changing your behavior. And saying, well, maybe I should just take 5 minutes and meditate, or take deep breathing rather than munch on chocolate or smoke. And I'm always dismayed at how many people in the hospital are secret smokers. Smoking is my enemy because it's my enemy with heart disease. And I find, wow, isn't it ironic that you work in a cardiology office? Isn't it ironic that you work in a lung office, a pulmonology office, and you smoke? And the reason is stress. We don't talk about our stress with each other, so what do you do during your lunch break? Well, you escape and go take a cigarette. But if you think about it, smoking, not the act of smoking, not smoking itself, but the taking time out to not do anything is a form of meditation, but that's like a negative form of meditation because you're ingesting something that's bad for you. But ironically, people who smoke, the reason why they find it stress relieving is because they're not doing anything else. You can't talk and smoke, right? And you're actually you're not at the computer. You're actually taking, and so when I see people outside of, and unfortunately you're breathing on it. So I'm not saying that smoking is a good thing, but I find that if they could learn how to use that time and do something that was better for them. They're fine. I can't say that it is formally. For some people, it can be stressful for one and stress relieving for the other. Exactly. And I had someone ask me about massage, and of course, I mean, it sounds good to me. This is just a short list, and this is really compiled from what do we officially comment on as doctors. Oh, there are many things that you could do, and I've been reading a book on, and I mentioned on happiness in Denmark. Denmark has worse weather than we do. They're the happiest country in the world. And in their culture, they value something called hygge, which is coziness. And so that's their way of stress relief. In the worst stressful environment, they create an environment of peace by being with other people. So I didn't include social activities, but that's a huge stress relief for people. If you live in a community where you don't see your neighbors, you don't see anyone for 6 months, it's actually more stressful for you. You don't see your family. Being around other people is a great form of stress relief. And I think learn something from the Danish, because they're the happiest people and their weather's worse than ours. Yeah, sure, yeah. Yes. Yeah, and increase in heart rate and changing your, and like we talked about, it changes your blood sugar, it mobilizes fat, and so it has a lot of effects. Cortisol, growth hormone, epinephrine. I cannot, and the reason I cannot is I can't base it on scientific recommendations. Now, some people may say that there are certain things that they take that help them, and if it works for you, it works for you. But I do find, in terms of this, and this is more about what you can do rather than what you can take. I know that there are meds that you can take, and if you need medication, that's okay too. But sometimes a combination of learning how to control your response to stress with whatever you need to do if you need. And I'm sure you have a comment, Cause? Yep. Yeah. 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 Exactly. Yeah. Yeah. Ayurvedic. Yeah. It's hard to control. Well, like I said, seek peace, not me, Buddha. Seek peace from within and not without. It's much easier to control it when it's from inside you. Yeah. Yeah. Mm. Right. It's more powerful. Yeah. And when you have peace, you kind of attract peace, right? Depending on what your personal beliefs are, or life energy, or vital force, or what have you, but if you have agita, you attract chaos. If you have chaos, you attract chaos, or you look for it. If you have inner peace, you will find the good in things, and other people see the good in you. So, be who you want to be. There's nothing holding you back, really, except for yourself, and what you tell yourself and how you react to stress. But by no means am I an expert. I'm just telling because I know. And it's an evolving thing, and no one's an expert. But there are people that are better, and Tom Brady is a great example of someone who's very good at playing a mental game. You can lose for most of the Super Bowl and still end up the winner. You play a good mental game. And it's also, when you think you're winning and then you suddenly start to lose, it's a mental loss, right? It's you feel a level of defeat. I don't know if have ever played sports, but when you know that you're losing, it's hard to get your oomph back. It's hard to keep going. But the people who are slow and steady, and I think meditation also gives you a constant. So the wind blows, the snow comes, you're still the same person. Because they're your emotions. Well, I'm always impressed because I see people under different stressful conditions, and some of them handle it very well. And I just see the different reactions. And it's really your response to stress. It's not the stress. Terrible things happen to people. I see that all the time. But Oprah Winfrey did not by any means have a normal childhood. Her upbringing was quite difficult. She's an extremely successful person because she turned it around through her personal beliefs and then through practicing meditation and mindfulness. You can go through a lot of hardship and end up a winner. All right. Well, again, thank you guys. I hope you guys have a safe drive home, and hopefully you can incorporate this.